Good afternoon, everyone, and thank you so much for joining us at today's Afghan Resettlement virtual town hall meeting. My name is Vaughn Villaverde. I'm the Director of Advocacy at AACI, and I'll be facilitating today's event. Now, turning to the health side, Dr. Sahni, could you please help the audience kind of understand the process that Afghan individuals and families go through in trying to get connected with healthcare services?
Thanks for inviting me, Juan. I do want to say it's very good to hear everybody talk, and it was very good to hear Kathy give a bird's eye view. It was very important to have a complete holistic view of everything everybody's doing. But I do want to say that Santa Clara Valley Medical Center at Lenson is the sole provider of comprehensive health assessment services at Santa Clara County. So refugees or parolees, whenever they come to Santa Clara County, the VOLAC case managers assist them in applying for benefits, and they also schedule their appointments at our Lenson TB Refugee Clinic. They assist in coordinating their transportation to our clinic. And again, this has been echoing since the beginning that transportation is a major problem that these patients are facing. In their first TB refugee clinic appointment, they are oriented to the community services. They are taught how to schedule appointments through Valley Connection. In case they have any problems before seeing the providers, how to connect to urgent care or emergency services. They go through audio screening, visual screening. They have a comprehensive blood draw and chest x-ray if required. They also go through appointments with financial counselors to provide them with overview of healthcare options. And the most important thing is how to select a primary care physician, which is our ultimate goal, is to settle them with their primary care physicians. After that, they actually see us, which are the providers, and we do a comprehensive physical and mental exam, health teaching, vaccination update. And I have to say that we've been very successful in getting all these patients seen within, I would say, the first 60 days. We are required in the first 90 days, but we have been seeing everyone within the first 60 days of their coming to Santa Clara County. Then we refer children for vaccination clinic. We give them any medication referrals that they need. We are a big referral center, so if any specialty need is required, we do that. We give their COVID vaccination, which is a priority. Usually they get their first vaccination at the military health base. We give them their second COVID vaccination. Then they go for a one-on-one meeting with the AACI counselor, which is again very helpful. And then if there are any ongoing needs, such as treatment of latent tuberculosis or any ongoing medical need that we need to see them for a second, third, or fourth time, then we schedule them with us. Otherwise, again, the whole goal is to give them a comprehensive medical exam and then settle them with the primary care physicians.
Thank you. That's really helpful. And Dr. Sahni, from what you're seeing, how is the overall health of our new Afghan neighbors, and what trends are you seeing?
I have to say that I've seen a whole myriad of problems with Afghani refugees, from routine things like hypertension, diabetes, which sometimes can be uncontrolled, to all the way up to very high blood levels of lead in these children, which again, we've seen extremely emergently high blood levels for which we had to add like the same day, to patients who are coming in late third trimester of their pregnancies without any prenatal care throughout their pregnancy, and getting them to get scheduled with OB appointments within a matter of days is all that we've seen. Relatively other common health problems that we've seen is intestinal parasites, and a lot of them, and a lot of latent tuberculosis. Coming back to what Daisy said, a lot of mental health problems. We see a lot of anxiety and stress, it's not that these patients verbalize it as I have anxiety and stress. It manifests as abdominal pain, chronic pains, headaches, sleep disturbances, concentration problems. So you have to kind of discern as to where there is emotional and where there is physical problem. And in addition to that, there are sometimes patients come with real physical problems for which they haven't seen any physician or haven't sought care for months before coming here. So in general, I have to say that these patient ages range from, most of them I would say are from infants to their 40s. So they don't have a ton of chronic medical problems as we see in US, but there's a ton of stress and anxiety that manifests as different things in them. We also see a lot of malnutrition in children. So these are the things that we are seeing, a lot of things that we expect and some things that we are not expecting, and they just come in front of us.
You mentioned earlier that in your work and in Lenzen's work of making sure that all these social determinants of health are being taken care of, what challenges are you continuing to see related to health or access to services that are impacting health?
Oh, there is a very long list of challenges, I have to say. And I would say the biggest one is coordinating care for them in terms of lack of communication. We see a lot of these patients that they have no voicemail set up on their phones. Their phones run out of not charge, but just whatever the money in a couple weeks or months after they come to the county, and then they don't have money to get their phone set up again. So a lot of time we refer them to people, but they're not able to get communication to the patients because they don't have phones. The other big challenge is the language services. Most of these patients do not speak English, and it's very hard to communicate by the phone or video translators. We used to have a big problem of no-shows and late appointments, but we have been able to work constantly with the case managers to kind of have these patients come in on time or just show up for their appointments. A big problem that we are facing right now is vaccination in children, because our clinic traditionally has never vaccinated kids. We vaccinate people from 18 years and above, and children need their vaccination to get into schools. And we have been working very hard with all our specialized pediatric services and also immunization clinic of public health department to see if we can outsource this and these children can get vaccination in a timely fashion. I do have to point out a lot of things that we have overcome in terms of challenges. We've hired a lot of bilingual staff so that we don't have to, rely on the phone and the video translators. We have coordinated in-person translators who come to appointments with the patient, and I feel in-person language translators are absolutely no match to what we get on the phone. And as I said, we are in communication with case managers to coordinate for appointments, for their transportation. And I'm proud to say that 100% of our visits are actually in person, which I feel are very, very helpful, and it's very appreciated by the refugee patients, because we are able to calm their nerves, we are able to talk to them, and we've seen real benefits in which some patients have come in with chest pain and anxiety and tachycardia. And when we've spoken to them, our nurses have spoken to them, they've calmed down, and a lot of things get better when you see them in person and when you talk to them in person. We have increased our number of clinics 4 times, because as someone said before, we had very few refugees until last fiscal year, and our numbers suddenly have gone up. So we had to increase our clinic capacity to 4 or 5 times in a very short period of time. So I think we've reached a long way from where we were just a few months ago, but there are tons of challenges in front of us as well.
Thank you so much for taking the time to join us today. I hope that you learned a lot. I know I did. And I'm hoping that this rekindles the drive and the passion to help these folks resettle into their new community. Thanks so much, everyone. Have a great evening.